So apologies for the brief delay while we get our next panel mic'd up, but I did want to let folks know, if you haven't already figured it out, we did create a hashtag specifically for this event. It's HDP privacy. So if you want to follow along or tweet out, whether you're here in the room or with us virtually, we invite you to do so.
All right, let's get started. Good morning, everybody. I know we're running a little bit late, so we'll talk fast. This question of whose law is it and how does it apply is really incredibly important. Certainly at a gathering like Health Datapalooza, in which there are a lot of folks, whether they're small startups or large established companies, whether they're already in healthcare or moving into it for the first time, healthcare can be a really overwhelming industry for folks, and a lot of people are intimidated because it's highly regulated. So that's what we're going to focus on today. The other challenge is that often there are a lot of gaps. You know, you've got the FDA, you've got OCR, you've got this alphabet soup of government agencies in the US, and people don't know where to start with that unless you've lived in this area. So luckily for you all, we have this amazing panel here of several different agencies who've already come together to start to address these questions, as well as a patient advocate to help put this all in perspective. So what we're going to do is kind of a lightning round of introductions and kind of put this all in a big picture context with a kickoff from our patient advocate here. And then our friends from the federal agencies are going to walk us through an existing tool. Again, they've already thought through this stuff. They're going to share what they've done and get some feedback. So without further ado, I'm Ligeia Ricciardi, and I myself, I work as a consultant currently, but I've worked both inside and outside the federal government in this building, actually, for a number of about 4 years at HHS. And I have spent so much time trying to translate between these worlds, the private sector and the public sector, and so I'm very excited that we have some tools to help bridge these gaps. Next up.
Hi, I'm Lauren Cook. Am I on?
You're on.
Okay, cool.
Just briefly, who are you, where do you work, and what do you do relative to this space of digital health?
Sure, I'm Lauren Cook. I got dragged into this circus about 5 years ago with Billions Health Data. My job was to ferret out data sets to provide to our clients in their analysis. And in the course of that, about 3 years ago, I got really excited about the promise of what open health data and carrying that data could do for me personally as a caregiver. My dad's a cancer survivor, and he is receiving care in 3 different states. So he has doctors that are very spread out. I think the last count was about 15. So I was looking at the potential of having his own records in my hand that I could bring from one place to another. So kind of jumping, a leap ahead of the industry and solving some problems that I had. And that's been an incredibly challenging thing to do, not just getting the records, but deciding what app to use for what purpose and would it be secure. That was a huge stress for us and something that I'm hoping we can talk about and get closer to solving.
Thanks. So I'm Cora Hon. I am with the Federal Trade Commission in the Division of Privacy and Identity Protection. The FTC has long focused on protecting data security and consumer privacy, and we do it in 3 ways: through enforcement actions, through policy work, and through consumer education and business outreach. And this tool that we'll talk about today is an example of our outreach to businesses.
So I'm Baku Patel. Can you guys hear me? I guess. I love how Lauren sort of brought in, like she was dragged into the circus. So I'm part of this circus for a while. So I lead the digital health initiative at FDA at Center for Devices, and I've been working on not just mobile apps, but just generally looking at how digital health technologies can actually improve patients' life and how can they engage, and how can we use regulatory tools from an FDA perspective to promote innovation as well as protect patients at the same time.
Good morning for those in the room and those joining us virtually. I'm Katherine Marchini, and I'm the lead of the Privacy Division within the Office of the Chief Privacy Officer at the Office of the National Coordinator for Health Information Technology. ONC is the principal federal entity that's charged with coordinating the implementation and use of the most advanced health information technology, and that includes mobile apps for the use of electronic exchange of information. And particularly in the privacy and security space, we have a role to play regarding informing stakeholders and coordinating with our federal partners.
Good morning. I'm Linda Sanchez, and I'm in the Office for Civil Rights. I think Jocelyn Samuels did a great job explaining what we do there, so I won't repeat all of that. But what I focus on personally is looking at the intersection of HIPAA protections and all of these new technologies, and trying to help all these new stakeholders, new users of health data understand what protections they may need to apply to the work they do, and when they might want to be looking to other agencies for their authorities. So we also feel like this is an incredible field for possibly enabling individuals to really exercise their HIPAA privacy right of access to their own information. So it's a very exciting area for us, and we're very happy to be here.
So as a reminder for folks of the big picture, again, there's tons of new investment in health IT, and particularly, although not exclusively, in the consumer-facing realm. Venture capital dollars pouring in, investments from existing companies, Google, Apple, Samsung, you name it. What is the goal? What is the hope? What's the vision that we want for consumers and people? And how far are we from it, Lauren, based on your experience as a caregiver?
My vision is simply to be able to take the records from one place to another. If I want to see a new doctor, here, have it all. Not call and ask, what's your fax number? What's the old doctor's fax number? Request, move, from one place to another. And, that's really my vision, is to be able to carry it in my hand and me be the controller of it and allow who gets to see it and who shouldn't.
So that's, I think, one big important piece of what we're trying to enable, although there are other pieces too, certainly to patient engagement and improving population health and increasing safety, saving costs, all kinds of things. But the point is we have a ways to go, and certainly this piece of creating clarity about where the regulatory framework stands and how it applies is really important. So tell us, what is this tool and how did it come about? Katherine, Baku, what happened with this?
Sure. ONC is thrilled to share this, new educational resource with the community. I'm not sure if it's as exciting as the planning for the unveiling of the new Tesla model, but I can tell you that we were as dedicated and deliberate in our approach. Some may remember in 2012, on this exact stage, ONC hosted a mobile device roundtable particularly around privacy and security in healthcare providers, in which we talked about the challenges as well as coordinating the role of federal in health. Fast forward to today, I will talk loosely about the why and the what that brought us to what I like to call the Navigator Tool. Overall, ONC does believe that mobile health, including mobile health apps, holds great promise to improve health and health care. We recognize that patients want to use mobile to engage with their health, as well as clinical care teams to use mobile to improve healthcare delivery, as well as research and health outcomes. Although today, with the health industry really relying on, I know there's been a lot of talk about trust and confidence of these stakeholders using these devices to engage with the healthcare system, we recognize that traditionally these groups do not have core competencies in privacy and security. And so ONC to date has predominantly focused on educating the end users, be it the consumer or the clinical care teams, in engaging with this space. However, early on, we did recognize that there is a key stakeholder group that is very focused and interested in healthcare delivery, but we had not really focused on the education around privacy and security. Particularly, that is the mobile developer innovator space that really are interested and eager to enter the marketplace, but may have some of the same challenges as the end users and not really having core competencies around privacy and security. So in realizing that the use of mobile is not necessarily unique to healthcare and the exchange of information, ONC has been monitoring the outreach and engagement in the overall mobile space for quite some time now. Some of you may realize or have been involved in 2013, where there was a Department of Commerce multi-stakeholder initiative where there was a look at the mobile transparency and engagement across the industry. In 2014, after several months of coordination and outreach with the federal partners, we kind of arrived at what you'll see today, but it really was a joint effort to assist mobile developers in navigating the existing federal regulations around privacy and security that might relate to their product. You know, overall, it really is an effort to help consumers and clinicians have confidence in and trust in the mobile technology that they choose to engage with in managing their care. So ONC, FTC, OCR, and FDA, we embarked upon a path to develop a central resource, plain language, easy to use, for app developers to demonstrate the what federal regulation applies to a mobile application, the underlying, you know, circumstances of when it might apply, and really wanted to link to existing resources that a mobile developer might, you know, encounter with developing a product. You know, ultimately, you know, we at ONC wanted to empower mobile developers to be a trusted third party or broker that safeguards health information while facilitating information exchange, bringing the information to the point of care and beyond that end users, the consumers and clinicians are able to benefit from. So Gia, that's just a little bit from the ONC perspective, and I know everyone's, the suspense is probably eating at you to hear kind of the rest of the story. So
I just want to say nice work as the national coordinator to help coordinate all these other entities to come together. Real quick, but cool, from your perspective at the FDA, why'd you get involved with this? Is it just because ONC said to?
Yeah, it's always like that. But I think the real fact is, like, when we had our mobile apps guidance, we got a lot of questions coming through about privacy and then about consumer protection and so on and so forth. And we've been getting this, and I think I would, if I may speak for FTC and OCR, I think they had the same sort of reaction from folks saying, when is it happen? And as people got more aware that federal government is also interested in promoting innovation in this space and helping patients, I think people became more aware of sort of the agencies. But then the next question was, and as we talked about, is like there was a lot of confusion. So we looked at as an opportunity to sort of not only collaborate, but also sort of provide clarity for folks to think about when those things would apply. So I'm going to turn it to folks to see.
We want to see the Tesla.
Let's just
unveil.
Go unveil.
Okay.
All right, so what we thought we would do is give a brief overview of how the tool works and then actually take you guys through a hypothetical. And we're going to actually try and get to the live tool to see if we can do that. But first, let me just see if I can show folks what it looks like quickly. These are just screenshots. So what the tool is a series of high-level questions and prompts that ask a developer certain questions about their app. So what information does their app collect? What are some of its functions? And then also some questions about the app developer themselves. Are they a covered entity? Are they doing it on behalf of a covered entity? And through a developer's answers to those questions, the tool tries to guide them and let them know which of certain federal laws applies to their app. And so you'll see there are a series of drop downs, and you'll answer yes or no, and your answers will prompt you in certain directions. And then also, and this is a very important part, link out to, as Katherine was saying, resources on the websites of FDA, OCR, and FTC. So for example, the FTC section will link out to a set of best practices that mobile app developers can use to build privacy and security into their apps, as well as some guidance for developers who want to make sure that their claims are truthful and substantiated. And so I'll just show you some of these screenshots. Whoops. Sorry about that. Get back to here we go. So here are some of the slide shots, and we'll show you sort of, this is with all of the yes and no's open. And I will let Linda now sort of take everyone through a hypothetical. But let me just say, so one of the things that we've learned as we've rolled out this tool is that some people, I think, are jumping in the middle of the tool. So just as a practical matter, when you are using the tool, it's important to go from the beginning to the end because your answers to the questions will sort of send you in different directions.
Okay, so I have to tell you, we had a lot of fun creating this tool because we were not, in fact, experts on each other's laws, so it was very fun to see how they do interact. One of the things that is very clear to us from our conversations with the industry is that the same company, the same developer might be offering several different products at the same time, or they might be morphing their product from one user to another. And answers to these questions will differ depending on those configurations. And some laws might apply to part of their work and not others. So it's a complex area, and we were hoping to bring some clarity to this. So we have a couple of apps here. These were based on a series of conversations OCR and ONC had with app developers a while ago, also from use cases that have come into us. And you can find more of these actually on our portal that we'll have a link to on this so you can see how different versions of this might play out. So the first here is App A. The situation is a doctor counsels a patient that perhaps she could maybe lose a little weight, add some exercise and diet changes, and that the provider, she likes a particular app. She thinks that this is useful and her other patients have used it. And the reason the provider likes it is it can produce a report that can go back to the provider. And so the patient downloads and uses App A. And then before her next appointment, she actually uses the report feature and sends a summary report to her doctor before her next appointment. So keep this in mind. Now, App A is having such fun with this. This is going so well, but they're seeing that there's a new market possibility where they would work a little more directly with their providers. So now they offer, in addition to the previous app, now they have App A+. And this is a tool for provider. So for the provider, they can do remote patient health counseling, monitor patients' food and exercise, and do patient messaging, and it integrates with the EHR. So it offers a lot of opportunity for more powerful data. So we'd like to switch now to the, how do we switch to the tool itself? There we go.
While we're doing that, how do people find this? If they just want to, what's the easiest thing to Google? What's it called? Where does it live?
It actually lives at the FTC. You can get it from all of our agencies. So if you're at the OCR webpage, you can get to it. Same thing with ONC and FDA. I think you could probably just Google mobile health app tool and it'll come up, which I think I have done. So, okay, so this is the first page of the tool. We have a little background section, and then we start with the questions. So, so for the first app, does the app create, receive, maintain, or transmit identifiable health information? A little unclear, but probably. This app knows the name of the user, is producing reports with all kinds of information around her health. So we're going to say yes. Okay, so let's go on to question 2. Are you a healthcare provider or health plan? Well, the App A developer, we have no information saying that it's actually a healthcare provider or health plan. This is a private organization developing what they hope is a useful app, so we're going to say no. Does a consumer need a prescription? Nope, this is just something they got in the App Store. And are you developing this app on behalf of a hospital or a doctor's office? No, again, this is a private thing. Diagnosis? No. So at this point, I don't know if it's up there, you can see it's likely not covered by HIPAA because HIPAA really applies to covered entities, those health plans, those healthcare providers, those doctors' offices, and to people who work for them. So that was the on behalf of concept there. If you work on behalf of a covered entity, you're a business associate of that entity, and therefore you are subject to the HIPAA security rule and parts of the privacy rule and the breach notification rule. So we've now gone through the HIPAA questions. So HIPAA does not apply here, but there are other laws that might. So I'm going to turn it over to Baku.
Thank you. So you have to answer, like Cora said, that you have to walk through the tool completely to sort of understand which rules apply. So next question is, from FDA perspective, is the app intended for use in diagnosing a disease or other conditions, or in the cure, mitigation, treatment, or prevention? So you could think about remote patient monitoring as something that would be used as part of that functionality. So let's just click on that. Let's hope the demo gods are actually shining on us today. So if you answer yes to that, I think, so the question is, yes, your app could technically meet the definition of a medical device, but really, if you really want to get the answer of whether FDA has been will actively regulate it or not, you need to go to question 6, which will scroll down, if I can. There you go. So question 6 asks about the risk of the product and things that FDA had already said in their guidances on some types of apps that we would not actively regulate. And if it fits some of those things, and it looks like it's automating simple tasks, it enables users and providers to interact. So that's what I sort of would answer this question as. So if I say yes to that question, it basically, FDA considers your app to be of minimal risk and does not intend to enforce compliance to its regulatory requirements. And in order for you to know more of how the context, or about that context, we couldn't put it all in this tool. So we give you a link on this website, on the answer to sort of go to the FDA website. I will not click that because we will never come back to this. So in case you have to answer question 7, and if it doesn't meet that criteria, which we talked about in question 6, you would answer yes to the question number 7, and then move on to the next question. So I'll turn it over to Cora from here on.
Okay, so the next question, question 8, asks if you're a nonprofit, which you'll see why it's significant. So there's nothing in this hypo that indicates that the app is a nonprofit. And so here you'll see that it's likely that the FTC Act applies, because the FTC actually has fairly broad jurisdiction with certain carve-outs, and among them are most types of nonprofits. And then you'll also see a little box here that gives a little snapshot of the FTC regulatory regime under the FTC Act, and there are similar boxes for FDA and for the HIPAA rules. But you are not done yet. You also must figure out if you're covered by the FTC's health breach notification rule. So question 9 asks, are you developing this app as or on behalf of a HIPAA-covered entity? So here I'll point out 2 things. One, there are links embedded in the tool that give you a little bit more information about, for example, what's a HIPAA-covered entity if you need it. And there are other links in the tool that link to a glossary at the end. As Bakul said, I won't link us there also because we're running short on time, but just so you knew that it's there. The reason why we asked this question is because the FTC's health breach notification rule does not apply to HIPAA-covered entities. But in this, there is nothing to indicate that you are developing this app as or on behalf of a HIPAA-covered entity. So then we're going to go to the final question to see if you are indeed covered by the FTC's health breach notification rule. And that question is, do you offer health records directly to consumers or interact with or offer services as someone who does? And in this case, under this hypothetical, the answer is no. In which case you learn that our health breach notification rule does not apply. And if you scroll down, you'll see the glossary that I was referring to, which will also help you figure out the answers to these questions. So, but if you remember, Linda talked about a slightly different version of the hypo, and I'm going to turn it back over to her.
It's a lot of scrolling. Okay. Okay, so let's go back to the top here. And remember, App A Plus now has a lot more meaningful interaction with the provider. The app developer is actually offering services to the provider, is providing interacting directly with the patient on behalf of the provider. So, create, maintain, transmit identifiable health information, yes. Are you a healthcare provider or health plan? No, you are, but some people are confused about that because they know they're working very closely with one. Are you doing it on behalf of? Yes. So here you go. By hitting yes, it says you are likely a HIPAA business associate. And as a business associate, you are subject to the security rule and some provisions of these other related regulations. And then you'll see here there's a great deal of information, or well, not a great deal, some summary information about the rules themselves. And it has links so you can go further to learn more about it. And also, it'll take you directly to the OCR's Health App Developer Portal, where you can look at a few other variations on these use scenarios and ask questions. And I think we will stop there. So thank you.
So time is tight. A couple little questions about this. You launched this not very long ago, right? What have you seen in terms of traffic? Are a lot of people using this?
I think we've seen pretty good traffic. I don't have the most recent numbers in my head, but the traffic was, there was a good amount of traffic, and moreover, when we were able to track the time people spent on the site, we noticed that they were spending, I would say, maybe 5 minutes or more on the site, which revealed that they were actually trying to work through the questions. And we've also gotten feedback as we've rolled it out from folks who have said that it's definitely helped clarify a number of things.
If there are folks in the audience today or elsewhere who want to ask questions that are not addressed here or to give you feedback about how to make it better, what should they do?
They should send it, I think, to any of us. We welcome feedback on the tool, absolutely.
And they can definitely offer feedback.
Is there a way to do that through here? Okay, excellent.
Yeah, so if you go to the OCR portal, we are really, it was designed absolutely to get feedback from the industry on how useful these tools are and what other questions you might have. So that is a really great way to provide comments to us about this.
For FDA, I would say that if you are into the FDA realm and you end up into clicking one of those links and end up in the FDA section, we have, not only you can email me directly, but also you can email digitalhealth@fda.hhs.gov, which is a portal that we have sort of established for folks to ask questions, and we get a fair amount of questions every month, and we get about 1 a day, about sometimes even 5 a day, so that's the range we get. So we have answered a whole bunch of questions FDA related, but this is a great tool for us to sort of get people who come from this broader picture and then end up in FDA and ask more detailed questions. What I'm seeing, just so that folks can see, is like before we used to get some simple questions, which they didn't. So now these tools are helping people answer the simple questions on their own, and then what we're getting is actually the next level questions. Excellent. So that's really good.
So Lauren, back to the consumer perspective. This is not obviously intended primarily as a consumer-oriented tool, but questions, comments, thoughts on any?
My thought as I was watching, I was like, oh, this would be great if I had some decision support like this to decide which app I want to use. Ratings. You look in the App Store and you see, what other consumers like, but that really doesn't. They could have 5 stars, but still not be secure. So I guess my question is, are there any plans in the future to release something similar to this, for a consumer perspective to know, I guess I could go here and see what kind of questions should I be asking or looking for, but specifically what types of apps are highest secure or most secure. Put that in your feedback suggestion box.
I would say that ONC has recently released requests for comment, an effort around a model privacy notice. It's not necessarily a direct decision support tool, but it is an effort to identify ways to be more transparent with the consumer, to understand a little more about where their information is being used, how it's being collected, to be able to make an informed choice when they may select it as a mobile tool.
Let me add just one thing. Is think about the perspectives. What we have shared with developers is also shared with the consumers as well. So the questions or expectations we're setting for developers should be hopefully reflecting the expectations that we want for the public. and the consumer. So think about it from that perspective. And I paused for a little bit because, you know, I was trying to figure out whether we're talking about app by app determination versus sort of what are the general expectations that we set up. And I think what our clarity efforts have been towards is like, how can we set the expectations for everybody in this area? What should they think about from an FTC perspective? What should they think about privacy perspective, security perspective, and FDA, safety and effectiveness perspective, is what we are sort of done. I think we have thought about the one by one, but I think scalability is a topic that we haven't sort of grappled with yet.
And we also sort of, at the FTC's website, we have definitely information for consumers when they are looking at mobile apps generally about what things to think about when you're thinking about downloading or not, but it's not precisely, I think, the tool that you're thinking of.
There's some future work to do, yeah.
Yes, you raised, that's such a good question. You know, from our perspective, we believe this information should always be held carefully and treated respectfully. And if an entity is your health plan or your provider, then we have very rigorous expectations for how they should be protecting your information. And that also applies to any app developer that is working with them. So if you are opening a portal that's been created for you by your healthcare provider, you know, you should be able to know that that is a secure place to be, that it has very robust security and privacy protections.
15 of them.
All 15 of them, yes. And so we're certainly hoping that you will find that.
So I hope you will join me in thanking the panelists, not just for their work here today, but the work they do every day in really serving, you know, the American public, and that includes you, Lauren. Thank you so much. Off this way.